Pre-oxygenate the patient. Select the appropriate tube size for the patient. Lubricate the tube. Grasp the patient's tongue and jaw with your gloved hand and pull forward. Gently insert the tube rotated laterally 45 to 90 degrees so that the blue orientation line is touching the corner of the mouth. Once the tip is at the base of the tongue, rotate the tube back to midline. Insert the airway until the base of the connector is in line with the teeth and gums. Inflate the pilot balloon with 45 to 90 milliliters of air, depending on the size of the device used. Ventilate the patient while gently withdrawing the airway until the patient is easily ventilated. Auscultate for breath sounds and sounds over the epigastrium, and look for the chest to rise and fall. Tape to secure, or use a commercial tube holder. Confirm tube placement using end-tidal CO2 detector. It is strongly recommended that the airway, if equipment is available, be monitored continuously through capnography and pulse oximetry. It is strongly recommended that an airway evaluation form be completed with any BIAD use.